Hey everyone, it's Dr. Hodges, and today I want to talk about hair loss, why it might happen, and what you can do about it. And so, there's actually a lot of different reasons why patients may end up losing their hair. There are some people that are unfortunately just genetically predisposed to that, and that's what you see in male pattern baldness, and unfortunately for some women, female hair loss. And that is really more genetically driven, and it's not necessarily secondary to high or low testosterone, but really more about the sensitivity of the hair shaft itself to testosterone and the different levels. However, what I would typically see in my patients whenever they have, after they've had weight loss surgery, if they begin to have hair thinning, it's secondary to nutrition. So what drives that? It's typically going to be driven by your protein. It's going to be driven by your iron levels as well as your caloric intake. So I'll be honest, I've taken semaglutide, and when I first started taking it, I did notice some thinning in my hair. That was not from the drug itself. That was really from the decrease in calories that I was taking. And so as my calories kind of stabilized a bit more and I got better about doing my protein, my hair growth, my hair thickness came back. And so whenever my patients come into the office and I'm harping on them, I'm like, do your protein. I am not kidding. Protein is so very important. So if you're on any weight loss program and you're starting to see some hair loss, number one thing you can do is aim for 60 to 80 grams of protein a day. Now, certainly if you are a bariatric patient, you know that if you've had a duodenal switch or a revision to your gastric bypass, you probably need to be doing 100 to 120 grams of protein a day. Now, what kind of protein? I will tell you, it does not matter. Just do something. I have a lot of patients that will come in and they'll ask me like, oh, do I need to do weight isolate? Or do I need to do this, that, or the other? And this is the reality. None of us are going to be in the Mr. Universe competition, and we're not doing major power building. I'm sure in those instances, specific types of protein may confer a little bit better benefit than others. But honestly, for our purposes, for the general population, when you are finding that your hair is thinning after starting a weight loss program, or even after a really stressful time in your life, what you need to do is focus on your protein. The next thing you can do, oh my God, I'm just seeing this on this video. There's something with the coloring on this. I promise you, I am not wearing a bright pink lipstick. I do not know why my lips look this pink. I don't have on a lick of makeup. Anyway, I digress. So focus on your protein. That is going to be most important. There are really good proteins out there. You know, I love my Premier. I also like Vital Proteins Collagen Peptides. DocHaleNutrition.com is really good. And also EggWhitesInternational.com. All fantastic sources of protein that are really easy to get down. You can take it like a shot. It's not about getting the volume in, it's about getting the amount of protein in. But the second thing that you can do is make sure that you're taking vitamins on a regular basis. Whether you're a weight loss surgery patient or not, if you're doing a weight loss program, you need to make sure that you're taking a good daily vitamin and keeping up with your iron, especially if you're a lady that is still having her cycle. So I will tell you, if you have a really irregular or heavy cycle, or it's lasting forever, and you're not doing vitamins, an iron deficiency anemia can certainly contribute to hair thinning and hair loss. So get up on that iron. And if those issues are happening, get to your OB-GYN so she can take care of all that business down there. A lot of my ladies will ask me all about that, and I'm like, if I'm going that far south, we're in a big world of problems. So I don't do any of that. All I know is that I have that, and I go to a specialized doctor for that. But the first thing you can do is certainly make sure that you're keeping up with your vitamins. Now, what are some other homeopathic things or other remedies that you can try to help you with your hair loss as well? So also trying to keep up with some decent amount of calories. If you've ever seen pictures of poor little girls that are anorexic, you will notice that they have really thin, stringy hair that is all secondary to nutrition. And so I certainly don't recommend that anybody goes on a crash diet where they're taking in 500 calories or less. You're going to see a profound impact, not just on hair loss, but you'll also have profound muscle wasting as well. So watch your calories, protein intake, vitamins. What are some other things you can do? So zinc has been shown to help. Taking extra collagen, and that's why I like that Vital Proteins. That's a protein and it's collagen, so it's the 1-2 punch that you can do. Folate, B12, those are all specific vitamins that are going to affect your hair growth. Now, there also is over the counter. Of course, you can use Rogaine if you want to use that. Some people don't like to use that every day for a variety of reasons. I'm neither hot nor cold. I do know that Rogaine can work, but there was a study that came out in 2015 that was actually comparing the use of rosemary oil to Rogaine, minoxidil, 2%. And they found that if you use that rosemary oil every day for around 6 months, you would have the same effects. So if anybody has seen online the use of rosemary oil, you don't just pour it into your shampoo and then hope it'll work. You don't just use it a couple of times a week. It's just like if you're using Latisse on your eyelashes. It's something that you have to do on a daily basis. You have to put the product in your fingers and rub it in and massage it in the area that needs to be affected and to have the extra hair growth. So I hope that this has been helpful. So protein. Keep up with your vitamins, watch your caloric intake, and then you can even try over-the-counter products such as Rogaine and or rosemary oil. The one side note I will tell you about rosemary oil is there was one study I saw that where you had to use it for at least 6 months every day, once a day, and there was another where you had to use it twice a day. So at the very least, you need to be using it on a daily basis for at least 6 months. They did not see any difference in hair growth at the 3-month mark. It wasn't until after 3 months of daily use that patients were beginning to see significant hair growth that was comparable to using Rogaine. So keep that in your back pocket. I hope that this helped, and talk with you guys soon.